Namaste everyone. I hope you all are keeping well both physically as well as mentally. I am Moumita Chakraborty, also known to you as Moumita Official. Welcome to yet another diverse conversation of the very special MODCAST series, where I bring to you stalwart trials from all over the world who have made the world a better place for all. And today's stalwart triumph is none other than Dr. Prasanna Venkatesh, who is joining us from Bengaluru, Karnataka today. Dr. Prasanna Venkatesh sir is a senior consultant pediatric urologist, robotic and renal transplant surgeon and managing director of DNB. He is also a urology teacher from the last 17 years in NU hospitals in Bengaluru, Karnataka. He is associated with the South Zone of Urology Association, Urological Society of India, American Urological Association, European Society of Pediatric Urology, and so much more. To know more about Dr. Prasanna Venkatesh, please visit my website www.moumitaofficial.com and click on the MODCAST page. Without further ado, let's welcome Dr. Prasanna Venkatesh on the very special MODCAST episode for today, and let us begin the session. Namaste sir, welcome to today's very special MODCAST. I am honored to have you on board today. And as you know that MODCAST is a combination of monologue and podcast. And this is an open mic platform where we discuss about your life journey, your achievements, your goals. But we begin with the very special part of our life, which is childhood. So before asking you that question, let me ask, how are you, sir?
Namaste. Thank you very much for having me. It's a privilege. I'm doing good, and warm greetings from Bengaluru. It is actually warm, the warmest summer ever.
So it's very hot, and it has just rained a few drops in some parts of Bangalore, which has made it even more hotter now. And we have to deal with that. Never mind, moving ahead. I hope you are in a comfortable situation, right?
Yes.
Okay. Sir, let us begin with your childhood, as I always begin with the childhood, because I feel that is the most beautiful part of everybody's life. Tell us about your memorable experience.
Yeah, my childhood was mainly all my memories are of my boarding school. This is one of the oldest Anglo-Indian boarding schools started by the Brothers of St. Gabriel at Yercaud. It's a hill station near Salem in Tamil Nadu. So
Okay.
I joined there when I was in the third grade, and I went on to graduate from there for the next 10 years.
Wow.
So it was a very close-knit community, and we did have a lot of fun, a lot of responsibility, and a lot of teaching and training that happened along the way. I believe that is what has given very, very strong foundations and the confidence to go out into the world and face anything as it may be. For anyone, the schooling is extremely important because it gives them a strong foundation to take the next steps. And it also puts into different perspectives as to what responsibilities that someone needs to take. And being in a boarding school, because I hail from a tier 3 town in Tamil Nadu, where there was no English medium school at that point of time. Of course, now things have changed. And my parents were doctors, so they had to, to educate me, put me in a place where at least English medium school was available. So that was my strong memories on childhood. And throughout my childhood, in almost all the grades, I used to secure the first rank. Those days, they were ranks, and there were prizes for the best subjects. So all the way
Wow.
third to 12th, and I was also voted for the best conduct medal and the best outgoing student in my 12th grade. Yeah, so
Wonderful. So you were a very meritorious student, sir, from childhood, it seems. And I was just about to ask you, how did you choose the career of a doctor? But you already gave me the answer that your parents are also doctors. So that happens in every family, I guess. My parents are also government employees, like public sector undertakings, and they also wanted me to be a government, sectoral officer or something related, which I became also. Anyway, it's the modcast about you. So moving ahead, I would like to ask you: do you have any special memories which you would like to share with all of us, which has made a very which has almost changed your life? Do you have any such memory?
Um, See, again, I'll go back to, I mean, this is about childhood that you're speaking, and
Mhm.
we were Yerkot, which is a very small hill station as compared to, say, Ooty or Kodaikanal, which are the much better known hill stations in Tamil Nadu. So on every Sunday, we were taken for walks into the estates where you could walk with nature, and you go through these orange orchards, coffee estates, silver
Wow.
oak, and that memory of being in nature and going outdoors has always stayed till now, where I always have a liking to be more of an outdoor person. So that's one thing. The second thing is there used to be a lot of estate workers. These are huge plantations, and the closest hospital was some whatever 40-50 kilometers away in a hill station. That means it triples the traveling time. And healthcare was very, very basic. So my parents being physicians, though my mother did not want me to become a doctor because of all the stress that's involved,
Mm.
at a very young age that I decided that I want to take up medicine as my vocation. And those were all some of the little pointers that helped me in my journey and decision making.
Right. That's really nice. See, we always miss those childhood where we spent, among this nature. Even I am born in Arunachal Pradesh, and I really miss those walks amidst the estates where the plantation workers are working and the sun is setting, the weather is cool. So, sir, the thing is, your specialty is pediatric urology. So why this? Why this specialty?
Okay, when I was very young, I wanted to become a cardiac surgeon. Cardiac
Okay.
surgeons at that point of time, the first cardiac transplant was done in South Africa by Dr. Charles Bernard, and the first bypass surgery in India was carried out by Dr. K.M. Cherian in Chennai. This must have been the early 80s.
Okay.
But then after I got into medicine, I developed a liking for pediatric surgery, actually. So the journey to become a pediatric urologist, it takes 16 years after 12th grade. So that's the amount of time it takes. So around 6.5 years for the MBBS course along with internship. And then you need to do your general surgery, your master's in general surgery, which is for 3 years. And after general surgery, um, what actually happened is I came to Bangalore to try and join the pediatric surgery department at St. John's Medical College Hospital. And when I went there, they told me that you're 2 days late, so the seats were already full. So why don't you try the Indira Gandhi Institute of Child Health? That's opposite. So I went there and they told me you're a week late. So pediatric surgery seats are full. So then they sent me back to St. John's, and because there was no vacancy in any other department, they said, okay, in the Department of Urology, there is a vacancy. Would you be interested? So I said, okay, let me join. And I joined the Department of Urology as a registrar, not for the post-graduation training. And
Oh,
after that, I got training in, I qualified in urology with the intention at that time itself that I want to do pediatric urology. When
wow.
I thought about doing pediatric urology was not yet an established subspecialty of urology in India.
Mm.
This is I'm about in 2005. So you had adult urologists and pediatric surgeons also doing pediatric urology, but pediatric urology as a subspecialty was not there. So after finishing my studies here, then I did some short stints of training at Cleveland Clinic in the US and at Boston Children's Hospital, again with pediatric urology, because those countries had established pediatric urology in the 90s itself. Then I came back and I wrote up the syllabus for pediatric urology. We started the first
Wow.
fellowship course for pediatric urology in India. Once we got the seat, we got the permission on Jan 26th, and the permission was ending on Jan 30th. This is to the Health University of Karnataka. So we couldn't get a
Wow.
candidate. So I enrolled myself. So
Oh my goodness.
I completed the graduation, and I am the first university trained pediatric urologist in India. Of course, after that, now there are more than 7 institutions that are offering this. And I'm proud to say that the pediatric urology syllabus that I had made, I have shared it to all these institutes, and then they have started the pediatric urology fellowship programs, which is after urology. So that's almost 16 years to establish this. The reason why I chose pediatric urology is that, see, no child should be born with any congenital disorders. But if a
Mm.
child is actually born with some congenital disorder, then hopefully it should be correctable. And what happened way back then in the 80s and 90s, India was setting up its healthcare infrastructure to take care of all the basics of healthcare, obstetrics, gynecology, pediatrics, cardiology, neurology, all these specialties, oncology, for example, ophthalmology, all these were also non-existent or were existent in very few places. So there was no time and energy and efforts for people to take up the next level, of
Mhm.
subspecialty. So now this has filled a niche space. So pediatric urology, I mean, unfortunately, the major congenital disorders, uh, the kids who suffer from them are from the poorer socioeconomic status because of whatever,
Mhm.
maybe nutrition during pregnancy, environmental factors of exposure, and things like that. So pediatric urology in the realm aims to sort out a lot of congenital urogenital problems that boys or girls are formed with. So that's in short of my journey with pediatric urology.
Wonderful, sir. It's a kind thought also what made it so beautiful. You have started the syllabus of pediatric urology, which was a subject of subspecialty basically in the beginning. Sir, the thing is, connected to this, I always ask this because I believe in this. Is that, do you believe that there is destiny? Do you believe in destiny? Because see, you were going to St. John's to pursue some like pediatric surgery, right? Right, and then you went to the opposite college, and then it was just 2 days. In St. John's, it was 2 days late, and there it was already filled up. Then you came back, and then you found the vacancy in pediatric urology, right? So, do you think it was all predestined?
I guess so. It's a set of circumstances, a set of people, and the environment that you are in that actually makes you what you are today. Of course,
Hmm.
those opportunities that come by, we should be smart enough to catch on to it. And
Hmm.
when I've been in my journey, I think mentors are very important, and there will
Absolutely.
always be people who will look out for you, guide you as to what requires to be done. But I guess that is
Hmm.
reciprocal. They would need to appreciate that, okay, here is somebody who actually thinks about something that needs to be done in the future and
Hmm.
work very hard to get where we are. And we also need to make sure that whatever we do is in the best interest of society at large. So, what happens in this particular my journey is definitely I believe that destiny has a very strange way of putting things in place.
Hmm.
Apart from whatever I have done, there have been very important people who have guided me when I was in general surgery. I was exposed to a lot of pediatric surgery by one of my mentors, Dr. Vijay Pujar. This is at Belgaum in northern part of Karnataka. And then when I joined my urology, it was Dr. Venkatesh Krishnamurthy who single-handedly trained me to become what I am today, who took a lot of interest in me. And there's Dr. Mohan who was there in St. John's who actually sent me to Dr. Venkatesh to get trained. So, it's like
Wow.
a lot of cogs together coming in to form a wheel, which eventually will make you what you are. So I very strongly believe in destiny, uh,
Mm.
uh, a twist of circumstances, people, and the environment where you are. And of course, you also need to be good enough and smart enough to, take on that opportunity.
Absolutely. Sir, like I always believe in that, but I was little hesitating to ask you this because you are from a science background. So I really wanted to ask you this question because do people like who are doctors and connected to science, most of them generally don't believe in kind of spiritual connections like destiny and the cosmic energy and stuff like that. But I'm really thankful to you that you told us about how important is the part of a mentor, how important is destiny, but you also have to grasp the opportunity which comes on your way. You have to be smart enough to always keep an eye on the positive aspects and take a note on that and move ahead in life accordingly, which suits you best and also helps the society in an overall way. Sir, moving ahead, like you mentioned about two people here, so I know that it is tough to differentiate, but do you have any other mentor from your childhood or somebody whom you want to give the credit for who you have become today? Because I have somebody like that. I have a guru like that.
No, it's definitely my parents because they were role models and they were very, very hardworking people. And they always told me that I need to do the right things all the time. They instilled a lot of good values, gave me independence of thought and action, and encouraged me at every step of my way. So that has also, evolved me into what I am today.
That's a wonderful thought, and yeah, parents play a very important role in the growth of a child. And what you have made is big, sir, because you have done so much for the society. And in India, especially, we believe doctors to be God. We treat doctors as God. We say, कि please save our near and dear ones because we feel that आप भगवान हो हमारे लिए. Like that's what is even shown in pictures also like Bollywood. If I talk about, so, sir, was there any kind of surgery which was kind of very impossible, but you came over it and it was kind of like a milestone for all of you, like you and your team?
Yeah, one of the most complex surgeries that we have done is for a pediatric kidney transplant, where we transplanted the kidney into a very small child. Her parent had given the kidney. The
Mhm.
child was around 4 years of age and around 18 kgs of weight. Um, had a stormy post-operative period of around 1.5 months. But at the end, the kidney worked very well. So that was one of the most challenging surgeries that we did together as a team, maybe around 5, 6 years ago. We've also done a lot of complex other works, but since you asked me, I think that just came out on the top of the list.
Oh, wow. The pain. So, see, here as a doctor, you might have seen so many people, families coming from different parts of the country or even from abroad. You will always notice that there is something like they are always emotional when it comes to someone near and dear one. How do you handle those situations, sir? Because some people even cry and they become so emotional. Please save my daughter, please save my father, or the person who is very near to me. How do you handle this situation, sir?
See, we need to be empathetic towards the family, because what happens is that there are some problems in kidney disorders that there are no solutions as yet. There are
Hmm.
some problems which are chronic in nature and they may require dialysis lifelong or a transplant. And there are some congenital anomalies that cannot be corrected. So the point is, first we need to listen out to them, we need to be empathetic with them, and then we need to state that we are there to support them in their journey towards getting better, or at least leading a better quality of life if getting better is not an option anymore.
Hmm.
Point is that once we cross that stage, then we need to counsel them, stating that what has happened, nobody can change. What can happen is something that we all need to, focus our efforts on.
Hmm.
And then we need to give them a working plan with something that they can look forward to in the next 1 month, 2 months, 3 months, something short term, so that they can put a proper plan of action in place and then take it up maybe 2 months at a go or 3 months at a go to see how the progress would be. Some of them recover and recover well and recover completely, and they may or may not require any further treatment. Some of them would require lifelong treatment. But I guess the entire crux of the matter is how well we counsel them, the patient and the family, and how much of time we spend with them, and how we understand what their needs and requirements are. And sometimes it is a financial need, sometimes it's an emotional need. Sometimes the place where they are residing in does not have uh, tertiary level healthcare facilities. So we need to look
Hmm.
at all of this from a socio-economic standpoint also. So it's just not the scientific base of treating them. They also say, medicine is, yes, it is a science, but the art of practicing medicine also plays a very major role on the trust that you can develop with the patients and the family. So as long as the
Absolutely.
communication channels are open and we give them a clear picture as to what they can and cannot expect, I think that's the first step in them accepting that they do have a problem, and then they
Hmm.
will work on it. And once that acceptance is reasonably done, then they are more amenable to the treatment modalities.
Right. And sometimes when you're speaking about lifelong treatment, when you speak certain things to them that okay, this is a lifelong treatment, but there are certain cases which are not that serious, kind of like I'm talking about diabetes, right? So diabetes is a kind of treatment. Probably it may go for like years and maybe lifelong also. But the thing is, it is not seen as a taboo to the society. But there are certain diseases which are similar to that, which looks to the society as a taboo. If I talk about this kind of urological problems, or what do I call it?
Infertility, infertility.
Infertility, yes, epilepsy, this kind of thing. There are certain diseases like that. So in that case, what do you suggest the patients? Do they need to worry about getting married to somebody? Do they need to consult the doctor before getting married, or like how open they should be with the person they are getting married to, or maybe connecting to?
See, what happens is, first is the fear of all these things and the taboo associated with it definitely needs to go. Even for that, they will require counseling.
Hmm.
Today, for most sexual related problems, erectile dysfunction, infertility related problems, earlier there was a lot of taboo of speaking about it. But today,
Hmm.
good treatments are available. Like in our hospital, at any hospitals, we have the Department of Andrology that deals with male factor fertility and men's sexual health. And we also have the
Hmm.
Department of Reproductive Medicine that deals with female sexual health and female fertility. So these are all subspecialty programs that have excellently developed, which also takes care of marital counseling, couple counseling, psycho
Wow.
counseling, and then they also deal with the actual treatment for sexual dysfunction or infertility. The point
Hmm.
is today, with the advent of internet and the availability of so much of data and blogs and knowledge that's going around, sometimes the patients or the people who are browsing the internet simply get lost, because a lot of what is there in the internet is unfiltered information. You either have the
Huh.
best or the worst of it, and so they end up wasting a lot of time. But if they actually approach the right specialists, and they will find that the department, the people in the department and the hospital are very much tuned to all of this. And sometimes the problems which they look at being very severe, the solutions are actually very simple. And that
Hmm.
once it is done, it is quite gratifying. So my advice would be to seek the right help with the right people, and usually solutions are available. But as a first step, somebody who is having these issues, I mean, I just gave few examples. It could be anything
Hmm.
else also. They should come out and then they should try and seek help. So seeking help is the first way. So we're not only looking at physical health. So there are three components. There is a physical health, then there is a sexual health, and more importantly, there is a mental health. So,
Yes.
today we are speaking about a lot of it about mental well-being, because when you call somebody healthy, the person should be of both physical and mental well-being should be there. So mental health is something
Yes.
that hesitate to talk about. So this is also something that a lot of help is available, and the first step is that they should come forward seeking treatment. So I don't think it is as taboo anymore, at least in urban areas or amongst the educated population. But yes, a vast rural area, that's a problem. And today, even mental health problems have got excellent treatment, and
Yes.
people very well, as long as they understand. So sometimes what happens is, even if one individual does not understand it, close family or friends have to take that first step to identify that he or she probably has this, and to help them seek help. That will make a lot of difference.
Yes. Absolutely, absolutely agreed, sir. I talk a lot on mental health, and I completely agree to what you have said that when the family members or the people with whom we are staying, they should first notice it and take them to the right person who can analyze that properly. In case if they are not able to solve it, so empathy or counseling by themselves. There are certain cases which are probably due to financial crisis or related topics to it, but mental health is very important these days because most of us are working mentally than physical labor, right? Most of us. So, sir, we have almost come to a conclusion of today's session, but there are a lot of questions to be asked. But I know that your time is very valuable and limited, so I would like to ask you two more questions before ending the session. The first one is, what is the message from your end to all the viewers who are watching us today?
Uh, Health is our biggest asset. We need to take care of ourselves to age gracefully. Depending upon how you see yourself when you are 65 or 75, the action points you need to take from when you are 35. So you need to eat healthy, you need to exercise, go for your annual health checkups, and make sure that you take health insurance. People in our country take life insurance. Life Insurance Corporation of India is one of the richest companies in our country, and people don't take health insurance. Health is going to be expensive because of all the technology, the manpower, and the huge capital infrastructure that is there. So, an
Yes.
advice would be that everybody, irrespective of age, irrespective of being a lady or a gentleman, you all will need to take health insurance and do your annual health checkups, which are preventive checkups, which will pick up a lot of things before, rather than it being quiet and then suffering from that particular problem for so many years without realizing that it is there, and then ending up with complications. Simply, there are a lot of diabetics, thyroid related issues where people don't even know that they have it. Simple checks
Hmm.
possible. And people should have adequate health insurance, so that that's one big burden less when we are surmounted with some serious health issues. We are already battling the emotions of having a serious health issue, and then
Hmm.
on the other side you're also battling the finances. So today,
Yes.
health insurance premium is one of the lowest in the world in India. We can't get it any better. So people should take adequate health insurance. So that's my message.
Thank you so much, sir. So I had two questions, but now I have one more questions. One more question connected because you have spoken about health insurance. So see, sir, even I wanted to take health insurance. My father also got treated from your hospital only, right? So that's how I got connected to you. So I just want to know. My father also always told me, "Ki you get one good health insurance." But whenever I go to take a health insurance, these facilities are there, and some insurance has this what do I call it, positive aspect, and some like insurance doesn't have that thing. So which insurance is best, sir? Which one should we go ahead with, the nationalized banks or private banks or anything which you would
Uh,
like to suggest?
Sum total today, almost all insurance companies offer the same facilities. But the
Hmm.
point is minimum be a 20, 30 lakh cover, because if we are, God forbid, hit with some serious cancer or malignancy, that is how much it is going to cost. Second,
Mhm.
the younger you are and the younger you take, the premium is lower, because as you grow
Hmm.
older, the premium goes up. But make sure that it covers all new age treatment like robotics, lasers, bariatric surgery, and things like that. And make sure
Hmm.
that it covers whatever a twin sharing, single room, and it should cover pre-hospitalization expenses of 30 days and post-hospitalization expense of 60 days. And today there are some insurance companies that even give you outpatient care and daycare treatment. And
Mhm.
there are insurance companies that cover transplants and things like that. The point is, even if you are in a family, you can take what is called as a floater policy, where individually
Okay.
each of you are covered for 10 to 20 lakhs, and then there is a buffer of at least 40, 50 lakhs which you can use, because it's very unlikely that 4, 5 family members in the same family become seriously sick in the same year. So that's
Hmm.
one thing.
Hmm.
The other thing that I would advise is, apart from your basic insurance policy, which you need to keep renewal, one important point to think is how long can you renew it? So there are some policies that you cannot renew after 65 years, though you've paid premium for say 30 years or 75
Okay.
or 80. And there are certain policies that you can pay endlessly. So it's preferable to take a policy that is at least 85 plus, right?
Oh.
Otherwise, suddenly you realize for 30 years you've paid premiums, and at the age of 70, they say, you can't renew it anymore. The second point before I wind up would be to take a super top up policy, which is very, very cheap. The super top up policy kicks in once your primary policy insured amount gets exhausted. Like, for example, if you have a policy, say for 10 lakhs, and some serious illness comes, and in that particular year, 10 lakhs gets exhausted. At that time, the super top up policy will get covered. A super top up policy for 1 crore rupees for somebody who is 30 years of age is just 8,000 rupees.
Hmm. Wow.
So what happens is, so then you're covered, even if you have a 20, 30 lakh policy, the super top up
Hmm.
policy will get in. So yes, people need to research this, see whatever it's best, but some health insurance has to be taken. And today it's a tax deductible up to some 25,000 rupees also. So in all ways, it helps.
Wonderful, sir. I think this is going to be helpful to each and everyone watching us today, because this is like we always get confused about which health insurance is applicable to all of us, and what you have described us today is like very very important and would be very helpful to each one of us. So thank you so much for this wonderful information. And lastly, before concluding, I ask all my like Stalwart triumphs that how would you describe yourself in just 3 words?
enthusiastic,
Wow.
energetic, pays attention to
Always
detail.
wonderful, sir. Wonderful. I'm absolutely grateful, and that absolutely describes you completely because I met you also in person, and I always got a positivity from your end, and I feel that all the patients who meet you also get the same vibe from you because you always treat them like family members, and that's the best thing about you, sir. I hope that you always stay healthy as well because you are taking care of so many patients, and may God bless you. You always stay healthy, wealthy, as well as prosperous. So thank you so much for joining us today.
Much. Thank you. It was a pleasure.
Jai, Jai Hind, sir.
Jai Hind.